not a voting member.
Let me verify the stream.
We will call the January 30th, 2025 Board of Health to order. Are there any announcements or adjustments to the agenda, Monica?
I don't think so.
See none, we'll move on to the consent agenda. Is there a motion to approve said consent agenda?
So moved.
A motion, is there a second?
Second.
Second, all those in favor, please say aye.
Aye.
Motion carries. Next, much anticipated election of officers. So when we say officers plural here, in the past, I believe we've only elected a president. Is that correct? Is that the only officer
Chair and
role?
vice chair.
Oh,
Chair, vice chair. Okay, we have chair and vice chair. Would anyone like to be the chair of the board? Don't feel I am
Oh, I
fine
thought
not
that
being the
was
chair.
I thought that was like you had to be the
I
chair.
don't have to be the chair. So feel free if anyone would like to be the chair.
What do you do as a chair?
Preside over the meeting.
I think you called meeting to order.
And I think you asked for people for approvals.
Yes. Anyone? Care to be the chair?
Just call the meeting to order?
I mean, you make it sound very elementary. But no, I think I started as a chair just during the days of COVID for the sake of, having been here from the start, but by no means do I need to be the chair. And if anyone else wants to be in that role and take a leadership role, I'm perfectly fine not being the chair.
Is it a one-year role?
Sure.
Would
you like to do it?
It's renewable.
Thinking about if the chair, do I have to be here for every meeting then? I mean, obviously.
That's why the vice chair, that's why there's a vice
We
chair.
have a vice chair.
So if you can't make it, the vice chair just takes the role.
I want to try this
All right,
chair.
Okay.
All right, so would someone like to motion?
I'd like to motion to nominate Sal as the chair.
I will second. Any further discussion on that? All those in favor, please say aye. Motion carries. We have a chair.
No.
And then I'll turn it over to you now. Oh, so you are now the chair of the meeting, but we do need to also elect the vice chair. Is that correct, Chris? So is there a nomination for a vice chair?
We have to do that now? I mean, are all the members here?
Yeah, they're all here. Well, except for Steve. He's on the beach, enjoying retirement.
So you could nominate Steve.
Nominate Steve. I'm going to nominate Steve.
He may have other business
That's true.
arrangements that might draw him away. It may not be the best idea to have him.
I would prefer that he be involved and make that decision.
That's fine if you guys want to wait.
Unless someone here is burning to do it.
Anyone? Okay, well, we can wait for that one. We can table that one. Can we not, Chris? Sure. All right. Sal, the floor is yours.
All right, next agenda is the program report, social work.
So maybe we do have a slight adjustment to the agenda. I thought I had updated that.
I don't like surprises.
First day on the job, it's not going.
Going right to his head, right to his head.
Your fist.
So I just wanted to make a mention about this election of officers and the duties of the Board of Health. I've been diving into the code, just making sure that we're dotting our I's, crossing our T's, etc. So according to the rules, we are to meet in January, April, July, and October. And in the January meeting, we're to elect the officers. So here we are. And there are a few other requirements. So I'll make sure to send those links for you guys for you to just review for your interest. But those are a couple of the key ones that I pulled out, as well as the how you would call another meeting to order if we needed another meeting in between January, April, July, and October. So those are to be on written request signed by 3 members of the Board of Health or on my request. So if we had an emergency or something, then we could call another meeting. So I think we've been operating a little bit differently until now, just with how we started with COVID, et cetera. So under the code, that's what it says. So our next meeting for the books, we already have it. It should be on your calendars for April 24th at 11 a.m. I think we have the time blocked every month just in case we were needing to call another meeting at a different time. But the anticipation is, hopefully everyone can make the April 24th. So if there's any concerns with that, just accept or decline the invite from Carrie, and we'll work on another meeting hopefully in April. The other thing is that the Indiana Public Health Association has put together a board packet to go through some of that. It's a little friendlier looking than reading Indiana code. So the link is here and is available to you all, but I'll send that out as a follow-up to this meeting as well, just for your interest, because it really goes through what the powers and duties of the board are. So I know it's been a while since we had the orientation. So just thought it was kind of worth having a look at that and getting everybody, reoriented and refresh our memories because it's been a while. Any questions about any of that, Chair?
Can we move on?
Sure.
Actually, I have one question.
Okay.
While you're on digging in some of the code, are there any anticipated change? Now we have a new administration. Any anticipated changes? There are major things we need to be concerned about in the coming year with the new administration?
I mean, there's lots of things that I'm watching with the new administration and with some of the new legislative agenda items that have been proposed. And I can talk about this a little bit later, just as far as 2025 priorities and things that we're watching. One of the things I'm watching, obviously, is Health First Indiana. This is a budget cycle year for the state legislature, so that means that it's time to renew that funding. So even though we just started our full year of funding for the first time, which is the second year of those funds, those were approved in 2023, so they're re-up for approval in the state budget in 2025. And as of now, I think both the House Bill 1 and the governor's proposal is a pretty deep cut of that program. So that obviously affects what we're able to do and the things that we propose. So if you're into advocacy and you believe in what we do, like that, maybe something to rally around.
I think it's also, it's kind of a double whammy, Kyle, in that we could see a reduction, fairly significant reduction in funding. At the same time, depending upon what they do with Medicaid, if they trim back programming for individuals, there's people that will have need and seek care that otherwise maybe are getting through other programs. So we could see potentially you could see an increase in demand while at the same time a reduction in resources to meet that demand. So it's certainly a dynamic and challenging environment we find ourselves in. That just 6 months to a year ago, we were like, wow, public health is really progressing. Well, now we might be facing some headwinds, to say the least.
So yeah, Health First Indiana is the thing that most directly affects us, like in a straight path, but there are tons of other things that will affect us in other ways and peripherally that I'm watching. But this session is early.
Any other questions, guys? Move on to the program report then.
Okay, so we're going to start with the social work program update. I brought Brittany Chevron Smith, our social worker here. I know you guys have heard about her, but you have not met her. So she's going to give a little update on the work in her program.
Yeah, good morning, everyone. I'm kind of curious who all of you are. Can I ask that real quick? I feel like I'm in a room of strangers.
Let's introduce ourselves.
Yes, please. Can I know you're Carrie, right?
So I'm Michelle Cesana. I'm actually a pediatrician by background, but I don't practice anymore. And I work at IU Health. I'm the interim president of the Indy Metro region, which includes Saxon Northwest.
Oh, you're a busy woman.
I am. University of Memphis. It's just a small job.
We're lucky to have her.
Yeah, thank you.
I'm Karen Collins. I'm a veterinarian.
Lucky to have her too.
Yes.
Kids in dogs.
And bats.
And bats.
Took care of it.
My sister did that, so I love that.
I'm Kyle Holtgren, a pharmacist by background. I'm a professor at Purdue University now.
I'm the chair, I guess. going to a Broadway show in New York to be in the chair. Family war, emergency physician.
I'm Emma Hauser. I'm a pharmacy student with Kyle this month.
My name is Richard. I'm a pharmacist and Dr. Holmgren's postdoctoral fellow.
I know who you are. Okay, good to be here with you all today. Thank you for that. I'm just curious, like, who was sitting in the room with us. So as Monica said, my name is Brittany Chevron Smith. I'm the social worker here with the City of Fishers. I work under the health department, but a lot of my job is in partnership with fire and police too. So you'll see here, I work with a team. I have 2 community health advocates that work with me as well. And the 3 of us together implement 3 different areas of support for the City of Fishers to promote health and safety and wellness. So I'll start with mental health. That's really my wheelhouse on the team. A lot of this work at this stage of my job is where I partner with police. So I follow up on all of the emergency detentions that take place in the city. So that's when somebody's deemed a risk to themselves or somebody else, and the police take them to the hospital. And you all are familiar, okay. So last year we had 166 emergency detentions. We have a whopping 21 already for January, so I can imagine the numbers will be a lot higher. But I did break down some age demographics on that too, because I think that that's important. 30% of all of our emergency detentions were for youth, and another 28% were that young adult age, 19 to 29. So it highlights what a lot of us already know or hearing, that our young people are struggling with their mental health. And so on the preventative side, we are looking at ways, how do we provide education in the community? How do we support families and schools so that we're addressing that need that we're seeing on our police side? I did 221 crisis response follow-ups. So sometimes when people don't qualify for an emergency detention, they might still have interaction with fire, or the police will still send me somebody who's like, they didn't go to the hospital, but they really have a need. Today we had a woman come to me. One of my colleagues found her. She was messaging the health department on Facebook. She appears, from what I can read, that she has a pretty active, untreated psychotic disorder. So we reached out to her and provided our social work team number and email address for her to contact us. So there's a lot of different ways that we're working with our population that's struggling with their mental health. Last year we had 4 suicides in Fishers, and while our goal is 0, obviously that's the number we want to see. We were happy that it was a pretty significant reduction from 2023. There's some things that go into play here, right? Like, for example, we have somebody right now in the hospital at Community who had an attempt yesterday. If that person ends up dying at Community North, they will not be considered a suicide death in Fishers, even though they were transported from their residence here. So a little caveat to the accuracy of that data. However, it still is promising. And yes, the goal of having 0 someday is what we're striving for. I noted here too, one of our community health advocates, he has a passion for recovery work and substance use disorder work. So this year, he has a master's in public health, but this year he got trained as a peer recovery coach. So we've really been leaning into that work more. We now refer all of our substance use disorder referrals, people who come through to us. He handles those patients and follows up. And he also developed a partnership with Recovery Cafe here in Fishers, where he's provided support to residents through that. So that's pretty cool. And then we have our fall prevention program. This was really a big reason of why the social work program developed. Originally, my job was funded on a grant that was a partnership between the health department and the fire department. And the fire department was pushing for it for a long time because they wanted to do some fuller work around falls. On the health department side, we wanted to address the mental health needs and education with the community. But falls is a big a big reason, like the roots of how all this work even started growing and unfolding. So we developed a Fisher's Fall Prevention Program. It launched in October of 2023, and we had 2 community health advocates supporting that as well as me. And in 2024, we had 42 people agree to participate. What that means, if somebody says, yes, I want to do this, and side note, most people say no. Even if they fall, they're like, it's not me. I don't need that. So we work on our approach and like figuring out ways that we can really reach these people where they're at so that we can help prevent future falls. But if somebody does agree to participate in the program, it includes a home visit with one of our community health advocates, if not 2. We provide on-the-spot assessment of their environment and look for any fall hazards or risks within the home. We have modifications that we can offer right then and there. And then we also have partnerships within the community to do maybe more intensive home modifications like installation of grab bars or ramps or things like that. We partnered with Purdue Extension Network and offered 2 classes called Matter of Balance. These are exercise-based fall prevention programs. It was a great partnership. We had so many people interested that that's why it went to 2. It was 1, and we filled up 2 classes immediately. So because of that need, we've been looking at how do we train our staff, our community health advocates, to do this work too. And we decided to go with the evidence-based fall prevention program called Stepping On. What's really cool about that is that there's a lot of different elements to that. Like you have a PT come, you have a pharmacist come, you have all these different professionals who are part of a person's journey to preventing falls. So we have our first one scheduled late spring, I believe, April or May. We're putting on our first one and we're going to continue doing that and offering that here in Fishers. Last year, my team and I, we served 1,147 unique patients or residents. We provided over 1,000 referrals to community resources as well. And part of what our expansion looked like last year in March, was it March? Yes, March of 24, we started offering a basic needs assessment to everyone who comes into the health department clinic. So we're looking at, do you have health insurance? Are you in need of food, housing, childcare? We ask about social connection and connectivity. And based on, it's voluntary, so our clinic patients don't have to complete it, but if they do, they get a direct follow-up with one of our community health advocates who then can connect them with resources and provide follow-up. So that's been a really great expansion of the work of my team. And we provided 323 residents or clinic patients with follow-up support last year.
One of the, if I can chime in, one of the great things that Brittany's provided that we haven't had in the past, from time to time, given my role, people will find themselves gravitating towards interacting with me, and they may or may not be in a stable mental environment. And Brittany and I get the opportunity to talk to these individuals. And what's great about what Brittany provides is she doesn't just meet with that individual, she oftentimes meets with the people around that individual and builds relationships of trust with a mom or a dad or a brother or sister, boyfriend, girlfriend, whatever. And that is really, really helpful because those folks oftentimes see that individual starting to head down a path sooner than the person may be even aware that they're headed down that path. And that really gives us an opportunity to get a leg up to say, okay, let's intervene sooner and find them help. Same with law enforcement. I know has found Brittany to be invaluable in a lot of very difficult situations with individuals who have made threats that they're going to do something either to themselves or frankly to others. And building relationships with those caretakers around that individual has been really, really impactful for the police department. So maybe mom and dad say, boy, he's headed in the wrong direction again. I feel like I trust Brittany. I'll call her. That's very different. Calling Brittany about that versus calling a police officer are 2 very different steps for a parent to take. And I think that's been exceptionally helpful for our community.
Do you do any focused marketing of your services? So for example, with the fall prevention, do you do like things in some of the communities where this might be? Okay.
We have flyers that we've put in all the physical therapy offices around town, all of the health clinics, like community health network places. Where else have we've advertised with churches. They're not, I don't know, they're not really open to it, generally speaking, unfortunately. But we've tried a lot of different things, and a really cool partnership, a place that we've recently found success is partnering with the fire department. So they have, there's different events that take place where residents can sign up to have their smoke detectors checked. And so we've started doing partnerships with them because once we go in and we can help do smoke detectors, a lot of these people are older adults in the community who are at risk of falls. Then we can say, hey, have you heard about the Fisher's Fall Prevention Program? What's that? We've got a lot of new interest in that way. So we're going to be moving more in that direction. Also, the two employees with the fire department who do that program, they're both female, and both of my community health advocates are male. So we've been partnering one of each. And I think that that provides some a softening of that in a way that people are more open to that. Maybe if it's like a husband and wife, it feels less intimidating sometimes than when my guys go out, you know? There's a hypothesis.
I think, I mean, I've done it. I've gone out and replaced batteries with the fire department before. I think there's something also to be said, older generations, if the gentleman of the house is not able to do it, having a female come out and do it might not be a dynamic that they accept well, where another guy coming out, maybe they accept that better. So to your point, having a team certainly makes a difference. But I've been out there with individuals who literally like, I got my hip replaced 2 weeks ago and I thought about getting up and doing that. I'm like,
please don't.
That is
Please don't.
Fall off a ladder while changing this one. Yeah.
And there's a trust with the fire department too, in a way that maybe we don't always have as health department employees. So it's just becoming a really good partnership that we're going to do more of. I wanted to send this around too. We recently had a resident write a letter to one of my community health advocates thanking him for his work in the fall prevention program. So I brought that today to share. You can hear it from them.
And that same resident sent me a copy as well.
Yes, they noted that on here. P.S. A copy was also sent to Ms. Monica Helps. Here, I'll pass that.
Thank you for your
Any
question.
other questions out there? Well, thank you very much.
Yeah.
It's kind of like behind the scenes that we don't get to really see. It sounds like you've teamed up with the fire department with the fall prevention, the mental health. Are the schools open to work with you? I mean, I'm assuming 18 and under is majority are going to be students.
Schools are open to working with me. We have some, Monica, maybe you can speak to this.
The PR way of putting it?
No. So we're working on an MOU with the schools to make sure that we're sharing information appropriately. Schools are regulated by FERPA. We're regulated by HIPAA. Like, it's just a little bit messy. So we want to make sure that we're doing everything appropriately. But we do work with schools in a lot of other ways. For example, I think we talked about at the last meeting that we've funded an expansion of Project Hope, which provides support, gap funding support for when students are getting the mental health services through the schools, because the schools really have a really robust mental health program. And they have licensed clinical social workers in almost every school, and they are seeing full caseloads, but sometimes those are billed to insurance, and sometimes if the insurance hits the max, or a person is strapped, or they have a high deductible or something, we don't want to cut those services off abruptly. We want to make sure that we give them time to adjust that. So Project Hope is a program that's run out of the Hamilton Southeastern Education Foundation that has supported that for a while. We supported it additionally to expand that a little bit. So we'll see what comes of that. I do have an update on that here in a minute. But I think that, the schools do have a robust program.
And the schools, so you're spot on. Majority of that 30% are their students in HSE schools. So to be able to communicate with the school and make sure that proper mental health supports are in place for that youth when they're there, it's really helpful. If they have information that would be good for me to know as I'm working with a family, because it's probably not surprising to know that families might not always accurately report the same thing or share the same side of the story with us. But it's really a collaborative approach that helps a family move into success. Yeah.
Thank you very much.
So we're still on program report because there's a few other areas, right? So just in review, we talked about this last month, but 2025 priorities, I already kind of mentioned Health First Indiana when Kyle asked about it, just that being a legislative thing that we're watching, but also, you know, we are in the first full year of what at least in 2023 was considered full funding. And there are a lot of things attached to that, as you guys know, these key performance indicators, tracking all sorts of every activity under the sun that we do, and making sure that we're, you know, using that funding for the intentions that it was laid out at the state level. We're also working towards accreditation readiness. We are really close to, I hope, completing the community health assessment. The full data analysis has been done on the secondary data. We're now working to put together focus groups and the survey, which should be released, I think, in the next week or two for residents to take part of. So I'll make sure that gets to you guys as well. That is the first step in that accreditation path, but we're simultaneously doing some other things which involve like collecting documentation, et cetera. Big focus for this year is expansion of the clinical services. So I've been finalizing standing orders. We've gotten the billing online. Laura will give an update about that in a second, but I think when we met last, we had just started doing the billing under all of that, like whole long time it took us to get credentialed. So we're working out a few kinks, but it's slowly coming together. So these are the services that we're working on right now with the standing orders and making sure all the processes are in place and finalized. Travel vaccines, I know, were very popular when we talked about that last week. So I can report Dr. Robertson's online, but she has completed the yellow fever certification. So that, you know, we really felt like was a rate limiting factor on that. Not her fault at all, but you know, now we'll look into how long it takes to get that processed at the state level before we can officially give that particular vaccine, and then we can, you know, we're getting all the standing orders for all of those sorted out as well. So, and I definitely think that will be pretty cool when that comes online, because we really don't have any place really close to here that does those. And especially one thing, just as a side note, I was in clinic the other day, and there were families prepared to go to Umrah, which is like a Hajj light, like, so for Muslims, the pilgrimage that they're mandated to do at some point in their lifetime. They can also go on this like mini Hajj, which is Umrah, and, you know, Saudi Arabia requires a number of vaccines. And so they're saying, hey, which of these do we need? You know, and being able to help, you know, that population, which is important to our city, obviously. I think, I don't know, just kind of made it real. So let's get this going. Another big priority, you just heard from Brittany, and that was one of the reasons I asked her to come, is really working our, you know, expanding our social work program, streamlining that service integration with public safety where we can, and really kind of expanding what she's doing. You've, you know, now heard kind of about the impact and the different levels of impact it has. So we want to make sure that we're supporting that. And then we have hired a second health educator. I think I mentioned that at the last meeting. So really expanding those educational offerings to the community. She is diving in. She's got great experience. We're super excited about where to take this and really looking to expand our digital offerings as well. School health, I'll talk about some of the grant proposals we might have, but really trying to focus on physical activity and nutrition. And then just, still don't have the dates yet, but looking at those new food code standards we've been talking about, as well as being able to offer vital records to all Hoosiers. And then towards the end of the year, moving to the community center. So I think I mentioned this last time, but just those are where we're at on things that we're focusing on. I think you're supposed to focus on 3, but whatever. We've got plenty. Overachievers, I guess. So as part of that clinical expansion, I know that's something we've been talking about for a while, and everybody's kind of interested in it. I thought I'd have Laura give an update on where we're at with billing and how that's going.
Good morning, everyone. You can see on the slide that we, during the month of, this is from January 3rd when we started billing to January 27th, We have had 392 encounters and we filed 240 claims. During that time, we've received from billing a little over $6,000. We have outstanding about $33,000. But we did have a little snafu with one of our plans that we have now been able to work out, and the money is starting to roll in quicker now. So of that 33,000, the ERA is the electronic remittance advice. We have a little over 11,000 that we've received, with about 14,000 that's past the 30 days. Although some of that is included in the 11,000. So we are moving in the right direction. In fact, just before I came, I saw we got even more money in today, so that was exciting. You can see the trend for the month of January for the last 2 years prior to 2025, where our clinic revenue was only a little over $2,000. In 24, we were at 6,000, and then in 25, we're at 10,000 with probably receiving, I'm guessing at least another, well, with that 11, probably another 15 to 20, maybe on top of that 10 by the time the month closes out and everything gets posted.
We are experiencing what all of you find doctors experience in terms of insurance denying our occasional denial of claims. Go figure, even with public health and the rates that we're charging. So
most of that's been worked out now.
Good.
I think I only have about five or six claims that I'm working through, and some of it has to do with, we share tax ID with fire and ambulance billing, so kind of untangling that, even though we have different NPIs. But it's exciting. We're moving in the right direction, and excited to be able to bill for some other services.
So yeah, it's been messy and ugly at times, but slowly but surely we're working out the kinks, and this really was kind of the foundational step for expanding those services because we have such a highly insured population. We wanted to make sure that that was a priority, that we could accept as many types of insurance as possible, and especially the ones that most of our residents have. So we had to look into all of that, and then all the credentialing and just learning. But headed in the right direction. So excited. We wanted to give ourselves this time to experience how to bill, and then we can now start adding those services on. So I know you guys get it, but I had frankly hoped to go my whole career without having to deal with this. And I could not believe myself when I was like, this is a thing that makes sense.
Who staffs this clinic?
That's a great question. So we have full-time public health nurses, 5 full-time public health nurses. So their duties are kind of split between 3 areas. One is staffing the clinic. One is doing the case management and communicable disease follow-up that we're required to do as a local health department. So the 70-something reportable conditions. So they do all the follow-up on that. Some of them are more intense than others. Also includes animal bites. Which Karen knows. and then they're really kind of building our programs as well. So every staff person in the health department, I've kind of given them like program responsibility. Yeah. So for example, one of our community health advocates is the program is responsible for trauma and injury prevention as a program, and fall prevention falls squarely in there, right? But our nurses, they're working on building a mental health program and chronic disease program, because those aren't things we've been mandated to do. So they kind of took the back burner. But as we say, okay, what are the needs of the community? As we've done that data analysis, these are priorities for Health First Indiana, but they're also priorities for our community. Whether those things match, let's build that program around it. So they're kind of doing that building too. So not a skill set a lot of them came with. But one that they're excited about growing. One of them is our emergency preparedness coordinator, for example. So she's making sure we have emergency response plans in place, and is assisting anytime there's I say we haven't had any real outbreaks, but the threat of an outbreak or the suspicion of an outbreak, what are our next steps, and making sure we have plans in place for that, and that we're coordinated with all of the emergency response agencies should we need to be called on. One of them is our school liaison as well. So she's maintaining and growing those relationships with the schools to make sure that if they have a kid with mumps or measles or something like that, that they know what to do, who to call, that we've got an easy line of communication so that we can, and also so that they're assisting with any programs that we want to have in the schools, like maintaining those relationships, like some of the grants that we've talked about having with the schools, some of the programs that we're doing with them, making sure that we know who all the key players are and doing that. So those are kind of examples. They're doing a lot of different things. And then we'd still have a couple of supplemental staff from that we've had since the MassVac site. So after the MassVac site closed, we transferred supplemental staff into just to fill the gaps as needed. So when we have one nurse available, we can close that gap with one of our supplemental staff to administer those vaccines.
Excellent. Thank you very much.
I'll just give a quick update on our social service grants and kind of the metrics that occurred in 2024. So our first social service organization that we funded $20,000 to was Shepherd's Community Center, or Shepherd Center of Hamilton County. And they had 1,215 touch points with 175 patients through their Reaching Resource team. Also through their counseling program, they provided 115 therapy sessions for 44 sessions. And this is across all areas of HFI for tracking. So access and linkage to care, fatality prevention, tobacco prevention and cessation, and then trauma and injury prevention. They've been a great partner for us, and we do refer some of our older clients to Shepherd Center. Then we've also partnered with Breathe Easy Hamilton County, which we funded $10,000 for this organization, and they provided 150 individuals resources for cessation. And then they also were able to provide 300 education activities on the harms of vaping. And then 800 adults were provided education on the harms of tobacco and vaping. And then our third partner is what Monica had mentioned before, Project Hope through the Hamilton Southeastern Education Foundation. And this in 2024, they had 21 new referrals with 2 actively connected to Project Hope for financial hardship. Obviously, that program is ongoing. The money that we gave them is really to sustain the program for at least 3 years. So this was just within the first few months of funding that.
Yeah, we funded them late in the year.
Mm-hmm. Right. And then they also are providing a truancy prevention program for parents and caregivers to students. And so they had 1 class so far with 21 participants, with planning for 2 additional classes to be scheduled the second semester. In fact, I think they had 1 just on the 28th, so 1 recently. But that's proven to be very beneficial to the families who have children that maybe are struggling with attendance, or even just kind of some mental health issues and struggling with confidence and things like that.
Yeah, the truancy prevention was more like anxiety related. I think reticence to go to school, and that was what they were focusing on. But the outcomes, the pre and post test surveys that she sent over from participation, it was pretty cool. A lot of change behavior intentions, at least from.
That makes more logic, because a class to learn how to go to class on its face.
You got to go to the class. You got to go to that class to learn about
if it's like coping mechanisms for anxiety, I understand.
Well, the program is for parents to support their kids who are having anxiety about going to school or aren't making it to school, or maybe they're not supporting kids in the way that's getting them to school. So
yeah, it's providing the tools to help them navigate.
But the comments that people submitted, I mean, she shared all that with us, and it was very, very positive. Like, oh, everybody should take this. This is like really useful, helpful advice for dealing with my teenager.
So it's really so it's geared towards the parents.
It's geared towards the parents. Yeah.
All right.
Yeah, and the Project Hope, I know they hope to have a lot more participants. Obviously, we funded them with quite a a decent amount, but I think they're working through some insurance kinks. And then hope to get more referrals going as soon as those are worked out.
And then this isn't on the slide, but just a quick update too on our school health club grants. Last year we awarded $1,250 for 3 different club grants. And this again was money that was donated from Indy Fuel. They donated $10,000. So we've been able to fund a yoga wellness and resiliency club at Fishers Junior High. Also helped the HSC High School Riley Dance Marathon. They raised funds for Riley for Kids, but they had an activity night where 55 students were able to come, and then they were able to do health education activities, and then while also raising money for Riley Hospital. And then the Fishers High School Do Something Club is partnering with a memory care center on a project, so we've awarded $500 for that. And then in the works, we just awarded this week Fishers High School for their Cultural Connections Club. They're doing an international fair and culture night to educate the public on just our rich diversity and multiple cultures. And then they will students prepare with educational materials and food and even entertainment. And that'll be sometime this spring. They expect usually like 1,000 community members and students that participate in this. Yeah. So very exciting. And then also in the works is funding Iman School for some AED. Oh yeah.
Yeah. Okay. Yeah. So the next page, and do you want to go through this, or you want me to go through it? We didn't really talk about this one.
Yeah, I can go through it.
Okay.
So the grants that we've applied for 2025. We applied for the FDA VHA Retail Standards Program grant, which we have received the last, I think, 3 years, 22, 23, 24. And this helps our food inspectors go to training. That's what this pays for. And then also one of our inspectors' time to work on the retail food inspection standards.
Which are really the highest standards for food protection, and which the code that we've been talking about that Indiana's moving to is modeled after those standards. So it's really timely, but we really hope that we might be the first fully standardized program in the state. There is nobody as far along on this as we are. So our inspectors have quickly been recognized as leaders on this. So it's kind of really cool, and that's due to Dan Stewart's passion, honestly, because he's very passionate about this and really pushing it forward.
And the grant's not large, it's about $12,000, but it still helps move that forward. And then we also applied to the USDA Farm to School grant in coordination with HSC Schools, and that's a $100,000 grant for a greenhouse. And then we've funded.
And they would use the things they grow actually to serve in the schools, not like it would fully supplement anything in the schools, but they would actually be serving those foods that were grown with the assistance of the second graders going through the program that we already have. So I think it could be really cool.
And then grants that we have funded this year with our co-ed school liaison grant, we have funded some school nurse association memberships for HSC school nurses, and also
St. Louis de
Montfort, and then have also helped them purchase nursing conference for HSC schools. And we started open gym last Sunday. Yes. It's exciting.
Yeah, we had over 100 participants last week, and I don't even think it went out through HSC schools. I think it just was on the Parks webpage or Parks social media, but a lot of really good feedback and participation. So
What's the open gyms?
It's just a gym that's open. So we provide, I mean, really, like that's it.
What you missed there?
They made a gym that's open. Are they all open on Sunday?
They are not. The schools are closed, right? Like
so school gyms
it's
are
school
open.
gym. Fishers Junior High is the specific gym that we're starting with as a pilot, right? We purchased all the equipment, so it's not wear and tear on the school's equipment. They don't have to worry about it. So we've got lots of basketballs, pickleball, nets, and volleyballs, and whatever. And we're just there checking people in and out, making sure that the area is monitored, setting some parameters and guidelines, and people can come in and just play, right? whatever they want to do. We've got some different equipment to support them. I mean, because we don't have a lot of spaces in the community for just bouncing off the walls essentially in the middle of winter. So
It's trying to address a gap. Like all youth athletics today are very structured. You have to be part of a program, you have to be in a, and so there's an entire generation of kids or group of kids that maybe are not in some sort of formalized sporting, or maybe they are, but either way, just the opportunity to go to a gym and like see physical activity and hopefully some connection with other people, that really genuinely doesn't exist in Fishers today, even though on a Sunday there's probably 22 gyms sitting closed and empty. So the schools have always viewed it more as a cost and liability issue. You know, they didn't want to deal with it. So this is an opportunity to put a little money, not a lot of money, into just opening it up to allow families and kids to go do that.
So this is for the students.
No, it's for anyone. It was actually, I saw it on Instagram.
Yeah.
I was scrolling through it, it made it on there, and it's for anyone. I mean, you could go if you're 80, I think, as long as you check in and
you
had to sign a
I mean,
waiver.
we're using the school liaison funds because we're, targeting families and youth, and the intention of that is youth enrollment. But yeah, anybody can come. It's free. We're just paying the cost of the janitor and the equipment, right? Yeah. And we have these funds to do it. And we thought, you know what, like, if we can make this happen, let's try it and see what the appetite is in the community for something like this. We feel like it'll be popular, but at least first week, so far so good. Great feedback. A lot of participants, people just coming and going,
Sal's going to be in there hustling.
Yeah.
Playing a little ball.
I love pick up ball. Don't get hurt though.
Kickball.
Kickball. There we go.
Yeah. But we really want to make it intentional that this is for like really free play, and to discourage like teams looking for more space, because there are a lot of teams out there looking for more space, intramural teams that are like, oh, we just want to practice with our team. Like this really intention is for it to be a little bit less structured, a little bit more open.
Yeah.
Yeah. So a lot of families came.
Oh, and then we have a couple of grants in development. I talked about Iman Schools, the partnership for purchasing AEDs for them. And then we're also looking into creating a mental health training grant that providers within Fishers would receive funding for training that is related to youth mental health. So trying to bolster resources and things that we could refer people to.
And the Iman Schools one, they applied under the club grant, but we have that capped at $500, and they are looking to purchase 2 AEDs, I think, which would cost $2,000. And we're like, you know what? Like, there's no reason why they shouldn't. Why we couldn't just fund the whole $2,000 to give them this needed service. So we're just working with them to make sure they have a training and maintenance plan. And then we have a couple of new proposals that I wanted to put forth with you guys for consideration, just as we're looking to use these funds. I know we've talked about this before, but that school liaison funding, again, some of that went to fund the open gym, but that's very, very small amount. The AgriPark greenhouse with the HSE schools project, I put that under here, but we did apply for that grant from the USDA. USDA and FDA, everything, as you guys have probably heard, like a lot of federal stuff is on pause a little bit right now. So any of the new grants, I think they've decided they can still give out the money they've appropriated, but new grants, I think they may be a little bit delayed before we hear back from those. But potentially, if we weren't to receive that grant, perhaps we could consider using the school liaison funding to still fund that project, because we think it makes a ton of sense. We've got such a great partnership between the AgriPark and what we're trying to do here and get this fresh food into the schools. And they've already got a teacher in residence there who's teaching every second grader about the agricultural process. So it just seemed like too cool of an opportunity to not figure out how to move that forward. And then much like we did last year, we've been meeting with community agencies and figuring out like what other projects might we consider funding. So I would be looking for the board's opinion on some of these. The YMCA, they have a couple of things in there for youth that we could use school liaison funding for, but they put it together in a whole proposal. So I've got that like a little bit more broken down below under Help First Indiana funding, because most of that is adult related and chronic disease related. But as we've talked to the agencies and we said, look, these are our priorities. You know, I talked a lot about the open gym concept, like how do we get kids more active earlier, right? And how do we make that accessible for all families? We've had discussions with MudSoc as well about who's participating in their programs and who's not. And we're really finding that a lot of our immigrant families are not participating as much in MudSoc programs specifically. I think I don't have the breakdown on the YMCA participation. They were supposed to get that to me and I haven't seen it yet, but and the other thing is that MudSoc, I think participation is a little more geared toward 46037 zip code, which is the east side of Fishers. And we know that our social demographics and need is more on 46038.
Why would you say that?
Huh?
Why would you say MudSoc is geared towards one zip code?
I don't mean that they're advertising towards it. I mean, that's who's participating in it, right? So they have a higher level of participation from kids in 46037, and it's fairly marked, right? Like, and you know, there are many theories, and that's why I was asking the YMCA for the same data, because they're based on the west side, right? So I'm like, well, maybe more kids on the west side are participating in the Y programs instead. I don't know what the reason is.
There may also just be a lot more kids on the east side. West side's an older demographic.
Yeah. So lots of potential reasons, but we also know from our social demographics that the kids, that there are lots of groups of kids who aren't participating, right? And that the social needs are higher on the west side of Fishers. So just trying to figure out like, okay, how can we encourage more participation, because we know those lead to health outcomes? Like how can we build those opportunities and those engagements sooner? We also know that girls drop out early out of sports, right? And that falls out pretty heavily in middle school. So is there a way to bolster continued participation from girls in sports beyond middle school, right? So like just things that we've been thinking about, looking at, talking to these groups about, like, are there ways to support this? So the YMCA thought, well, maybe they could have access to 100 youth. I don't know if it'd be like a voucher program or something like that, to be able to go to their, open gym, pick up gym times or use the equipment or something like that. So that was one thought that they had and they proposed to us. MudSoc has proposed a few different things. I think just trying to figure out where their priorities are, matching ours. So they were proposing a student-driven pickup sports program, a girls' health academy, some community field days. I think those probably could be fleshed out a little bit more, but still just curious about your all of your thoughts. And then the Health First Indiana funding. Shepherd Center of Hamilton County has been a really great partner. I don't even think I quite got the numbers right here because I only did the first numbers as far as 175 people that they served in 2024. That was only part of their program. That was the Reaching Resources program. And we only gave them $20,000 last year and they did all of that, right? They've been a great partner, clearly matches with our fall prevention program. So we would like the board maybe to consider funding them at $49,000 this year, which is what they have said would fund a person to be stationed in Fishers full time to take care of Fishers residents exclusively. So they have a part-time person right now with the $20,000 that was doing that last year. So really great reach from that program and clear match of priorities. And then YMCA, again, they have proposed that they could do all of these things with $66,000. Supporting, they have a fall prevention program as well. They have a diabetes prevention program. They have a blood pressure monitoring program and a mental health program. So I kind of talked to them about what our priorities are. And they said, hey, we're doing a lot of this stuff already. So just, again, throwing these ideas out here, interested in your thoughts as a board on what we should maybe lean into more, stay away from, or expand more, get more details on.
One thought I had here, we opened this conversation today about the fact the state might come along and literally cut hundreds
Yeah.
of thousands, if not millions of dollars out of our budget. And so I think, from my opinion, the prudent thing would be to maybe not go searching for these opportunities right now, like maybe continue to develop and tease out the ideas. But we'll know by April or May what the landscape looks like for our future. And maybe the right thing is, before we just ask the board to decide these things, is can we come back and Laura or whoever provide like a clear financial,
Yep.
kind of like, here's where we are financially, because some of these sound like, really neat ideas, but if we're at a point where we have to cut back on core services or core mission, then we gotta like think about those things. So we're just in a really fluid time to be committing to any of these kind of things.
And I don't think any of these are quite ready for a full vote. I guess I'm looking to like, are there any that you want us to that seem intriguing, that you'd like us to continue to kind of diving into a little deeper? The other thing is there are not, the school liaison funding, it's federal funding, so we have some rules and restrictions we have to use, but we have the money in hand. Like, it's not a reimbursement, it's, we've met the deliverables. It was a deliverables-based grant, so we're not on a strict timeline. So finding the right projects is part of the goal for that. Health First Indiana funding, that's an annual allotment. I think we can roll over some of that, right? Is that right,
Yes.
Laura?
Yes. So we had a little bit of money left at the end of 2024 that we're able to roll over into 2025.
But we're restricted on how much we can roll over, are we, or are we not?
No, it just, there's the restriction on core services.
Okay, there's restrictions
versus
on
the
categories.
food and environmental, and then also on capital.
Right.
10%.
Okay. Okay, so there's no restriction on rollovers.
No.
Okay, that's interesting. Okay. So, yeah, and we are making like contingency plans and budgeting for the case based on the proposal.
How do those, timing wise, when's our next meeting?
April 24th.
We would know
Yeah.
where we're at
Yeah.
then, for sure.
Yeah. Yeah.
What jumps off the page to me, if you're asking, is I feel like the YMCA stuff is duplication for what we're already doing.
We don't have chronic disease programming yet. I mean,
Oh,
we
like
do have a
fall
fall
prevention?
prevention program. Yeah, theirs is a little bit different. It's more like exercise equipment focused, I think. But yeah, that's one of the reasons we switched to the stepping on. We don't have a diabetes program. Blood pressure monitoring, anybody can walk into our clinic anytime and get a blood pressure screen. We're actually going to be promoting that for the month of February for Heart Health Month. Mood lifters program, yeah, I'm not 100% sure how that's distinct and different from some of the other things, but obviously we know that older adults are at risk for depression. And then there's the third space. So I kind of liked, honestly, the third space idea a lot. Just even though we're doing the open gym, I just feel like we're in these spaces we have in the community.
Well, I don't know how all this overlays with the community center we're about to open.
Right, and that's
5 months from now
yes,
too.
exactly.
Free gym, so.
Yeah, it was like, so basically the YMCA is saying, hey, for $66,000, we can have 100 participants, or?
We can have all of those things. 30 participants in a fall prevention program, 30 participants in a diabetes prevention program, blood pressure monitoring for 25 people, 20 mood lifters, and then like 100, I think probably day passes or something for youth to use the facilities.
Okay, so that's 30, 60. So that's 105 participants.
Mm-hmm.
And then an extra 100 for the youth?
Yeah.
Because I was looking at the numbers and it comes out to $55 a month for 100 people.
Like a membership.
Yeah, I was like thinking like, I'm not really sure, like how do you pick those people?
The 100 youth or
Either
the
the 100
30?
youth or the other, like the
Well,
30
the other thing
participants?
is-
Program participants are often like referred in, like they're people who already are at risk for different reasons. So they're based on referrals.
The other question is, do they overlap? Right? Do you end
Are
up
they the
getting
same
blood
30
pressure?
people?
Well, yeah, I mean, because generally if you have one of those issues, you have.
Well, I mean, like if I'm referring, if a physician is referring, it's sort of like saying, well, why don't you just go to physical therapy? And so it's then I think it's kind of becomes gaming the system and all that. That's just my.
So I'm hearing maybe possibly duplication and like, let's maybe focus on something else or table this for now. Tell them.
I think tabling it for now is a good idea because I think to your point, we have no idea what's going to happen. I mean, I'm like sitting on the healthcare space. Oh gosh, like every day I'm like, well, let's see what we're going to do tomorrow.
Yeah.
And I appreciate, Monica, that you have the money. I could also see a world where you have the money and there are stipulations that could put on the money.
Absolutely.
Whether we see that today or not, I just think it's too volatile right now. And it also gives Mudsock, frankly, a little bit of time if if they can be a little more specific about what they would do. And which ties in nicely with mental health for kids. I mean, we know kids who are active actually do better from a mental health standpoint in a lot of ways. So how could you give them that time? Shepherd Center, you said, is a great partner. That might be a better place to go than to go to the Y too. So
well, I think we're all like, I mean, at least all of our team, it feels like the proposal from Shepherd Center was quite strong. I think they actually only asked for $20,000, but because that meant so many of our goals, we were like, we could fund them. Like, how much would it cost to fund them? So I guess that one seemed like a clear, like we should continue to support this program. But curious about that for you guys as well. Is that something we should or could possibly move forward with pursuing, or should we hold on that as well? Because they're an important partner that we're referring to.
Hold on it, given that it's helped for Indiana money.
Well, I mean, my thought is if they asked for 20,000 and that's what we funded last year, I don't know why you couldn't stay consistent with that. And then if the landscape, find out what happens and
go, oh, look,
look,
hey,
we're exactly.
They'll be thrilled.
Right.
Like,
for sure.
Yeah.
You did. And this, I mean, just to be clear, even though the state funding cycle and budget cycle is mid-year, our funding is this year.
Right.
So we do have this. We do have funds right now, right? They finally transferred them.
Yeah.
We do have the funds in hand now, but yes, planning for sustainability and next year and the other program sustainability that we had planned already, right? Is a key priority. So I think what I'm hearing, correct me if I'm wrong, hold on everything, but maybe it's okay to fund Shepherd Center at the rate that we've been funding them.
Yeah.
Okay.
I think that's reasonable.
Do we have to have a vote on that?
It probably wouldn't hurt.
Sure.
All right, how do I do this vote thing?
Ask for a motion just like that.
Motion to vote for the funding of the Shepherds at $20,000 for this.
Motion to approve.
Motion to approve.
Yes.
Do I hear anyone?
Second.
Second, okay. It's yes, no.
All those in
All
favor?
those in favor? Say aye.
Aye.
No? Okay, it passes.
There you go. That's what I'm
Got it.
I gotta write this down.
You'll get it. It'll come.
You know this stuff. This stuff
Yeah, we do it all the time. And like med exec and everything, we have to do all this.
Beautiful.
Yeah.
All right, was that the regular
That's the
agenda?
program report, yes.
Oh my gosh, we still have to do priority
And-
updates?
Oh, no, we did all that. Never mind. Sorry.
You worked the whole agenda on you.
I don't know if I can-
1 hour, we're done.
What about the regular items and unfinished business, new business?
That's up to you to decide. You're the board.
I don't have anything.
I think so.
I have nothing. No.
No.
You can ask for a motion to adjourn.
Oh, motion to adjourn the meeting.
So moved.
Second?
Second.
All right, votes? Aye? Yes?
All those in favor?
All those in favor?
Aye. Chris, you gotta talk to this guy.
All right. I liked it. Don't worry. I want to do everything in my life. So this is part of it.
You want to what? Redo everything? Do once.
He wants to read Robert's rules.
Oh, you want to do that? Oh, okay. There's no motioning in there. Like that chair thing is all yours.
That was hilarious.
Yeah, that was funny.
How are you? We're quiet.
You wanted to be chair, is that it?
Appreciating the